Hello everyone, I'm Dr. Amit Bhushan Sharma, Director Head Cardiology, Paras Hospitals, Gurgaon. Today I'm going to talk to you about a very interesting topic. We've had last 3 days, we've had about 3 cases, young patients, less than 40, having major heart attacks. All 3 of them had some kind of preliminary investigations done about 3 months ago, which was totally normal. It was the stress echo which was totally normal. One of them had a CT angio done which was totally normal. One of them had a CT coronary calcium score done which was normal, yet he had a heart attack. So is there any way to predict a heart attack maybe 1 year earlier, 2 years earlier, 5 years earlier? So there's a very simple remedy. It's an old treatment which was there, which is called as Ankle Brachial Index. So Ankle Brachial Index essentially means that you take your blood pressure in your arm in a conventional way on your right arm. If you are right-handed, check your blood pressure. Let's say your blood pressure is 120/80. Then you tie the same cuff in your ankle and check your blood pressure. If the blood pressure is 120/80 in the ankle, that means your ankle BP versus your brachial BP is same or normal. So that means your ankle brachial index, if it is 1 or 1.25, it is totally healthy. Why? What is the correlation? Because the heart gives rise to 2 major branches, one on the right arm, one on the left arm. That tells you the heart health. And then the whole 1.5 meters of blood vessels, it traverses and goes down to your legs. So it tells you about your vascular health, tells you about what is the status of your blood vessels, whether there's any muck, whether there's any cholesterol, whether there's any ulceration, and whether these are the ones which are more prone for having a heart disease in future. So if your ankle brachial index is more than 1 or 1.25, it is perfectly fine. The problem arises if your ankle brachial index is less than 0.8, that means you've got severe peripheral vascular disease or severe disease in your legs. And that means within 4 or 5 years, you can have a major heart attack or a brain stroke. If your ankle brachial index is less than 0.5, that also indicates that you have got a severe peripheral vascular disease and your chances of having a heart disease or a brain stroke is not far away. Other factors like a positive family history. It is not necessary that your mother or father should have it. Anybody in the family, your maternal aunt, your paternal uncle, anybody in the family has had a heart disease before the age of 60, that essentially means that your chances of having a heart stroke or a brain stroke is 3 times higher than the normal population.